Listen up, you guys. Our patient has 3 symptoms: irritation, dactylitis, and pylophlebitis. Let's see if we can figure out what the hell that means.
That's a great way to start the day, Hawks. Are you trying to figure out what the hell those symptoms mean in the dictionary, or what the hell a diagnosis might mean for the patient?
I was thinking along the lines of what the hell a single word in my sentence made sense in your puny brains. At least hell ring a bell for you.
Nah, man, I believe they're exhibiting signs of... Wait, let me check my notes.
Well, Leslie is right, and Randall is just looking for an excuse to...
Enough of this. It's clear as day that our patient has Lawrence-Moon syndrome.
But aren't you jumping the gun a bit here?
Yeah, Frank is right, too. We should consult someone.
People, I've done my research and plasma ablation is our best bet for this guy's condition. It may be risky, but trust me, it's the right move.
Hawks, you're not considering the potential long-term consequences of your decision.
I've been in the medical field a lot longer than any of you guys. Just do as you're told and perform the plasma ablation, okay?
All right, Hawks, if that's what you think best.
But remember, we go down this road, there is no going back.
There being no going back could be the best thing for all 3 of you if this goes wrong. Now get out of my sight.
I called you in here because we need to discuss your proposed treatment plan for this patient. You want to perform plasma ablation on them, correct?
Yes, that's right. This patient is suffering from a severe case of Lawrence Moon syndrome, and I believe that plasma ablation is the best course of action.
And you're certain of your diagnosis. We've had some past disagreements about this condition.
And we've also had plenty of successful outcomes, Tracy. My years of experience have taught me well, and I'm confident that my treatment plan is the right one for this patient.
I understand that you're experienced, Hawks, but we've also seen cases where your diagnoses were incorrect.
All of those were sabotaged by doctors jealous of my medical prowess.
I doubt anyone could be jealous of a hack.
I thought that too, and you're living proof of it, as I know not a single person who says they'd be like you if they took your job.
Damn it, I've got some bad news. The patient's condition is more critical than we initially thought.
And it's all Hawks' fault for insisting on using plasma ablation in your case when we knew better from the start.
I know, Frank. We can't undo what was done, but let's focus on finding a suitable treatment now.
Right? So how about trying that new gene therapy technique by using a laser pointer and some napalm?
I've heard it has shown promising results for similar cases.
While your suggestion is not entirely off the mark, I think we need to stick with more proven methods in this case. Let's go over our options again and see if there isn't a standard treatment protocol we can use.
I already checked those standard protocols, and none of them check the boxes. I'll bring up my idea with Hawks, and just see what he says.
Holy Jesus Christ on a cracker. I told you that plasma ablation was not a good treatment for Lawrence Moon syndrome. You nearly killed your patient with this shit. Don't think that just because he's all right now means we can ignore this mistake.
Dr. Hawks, we understand our error and apologize sincerely. However, what do you think the diagnosis actually is?
Yeah, Doc, we'd really appreciate it if you could help us out here. We're all ears.
Absolutely, Doctor. We're eager to learn from your expertise.
Lord Almighty, I told you minimum wage paycheck to paycheck life rejects that this was a bad idea for Lawrence. How are things going in oncology?
Well, I've been busy juggling a few cases lately. The patients have been a handful, but we're managing.
Well, at least you guys can handle it. Still no leads on my own case, though.
I hear ya, buddy. This one's got me stumped, too.
Well, I think I might have an answer to my riddle. It's not exactly what we were expecting.
You figured it out? How?
Just some of the latest research and a hunch or two. But don't worry about it now. Let me go and handle this.
Wait, where are you going, Hawks?
I've got to inform my doctors. Can't leave it hanging like this. Good luck with your cases, Johnson. I'll catch up with you later.
Sure thing, buddy. And good luck with yours, too.
I know you all think I'm crazy for walking into an operating room like this, but I didn't have time to grab a sterile suit.
Didn't have time. You stumbled out of the lunchroom looking for crackers to make a crucifix out of, in case Chaplain John didn't hear your blasphemous rage earlier.
You're right, Leslie. That's not safe at all, and we can't let him jeopardize our patients' lives.
Yeah, you need to get your head out of the clouds and understand that your actions could have fatal consequences.
I know it looks bad, but I don't have time for these formalities. This is an emergency. I've been studying this rare genetic disorder throughout my lunch break with Dr. Johnson.
And I'm sure he told you that diagnosing these syndromes is a complex process, which should be left to professionals.
Exactly. We have the necessary training and knowledge. You can't just jump into our roles like this.
Furthermore, what's your new diagnosis for epidermolysis bullosa simplex? I'm sure we'd all love to hear it.
Well, from my lunch with Dr. Johnson, I've come up with a different approach. We'll call it Hawkes' hypothesis.
That's it then. We're going forward with Hawkes' hypothesis on every case from now on. Strike us dead now, Lord, if you must.
No, I think he's completely fine with all of us being in this awful operating theater that should have been condemned years ago. I don't even know why we're using it. Well done, Tracy. I must say I did an excellent job identifying the condition.
Yeah, after making an ass out of yourself during lunch today.
If only my diagnostics team could be as efficient, then we wouldn't have had this whole mix-up with epidermolysis bullosa simplex.
You're talking about the same person who gave us that incorrect diagnosis in the first place.
Well, yeah. I just hope they'll learn from their mistakes.
I'm sure they will. However, you should be focusing on improving your own diagnostic skills instead of blaming others.
What's that supposed to mean? It's not like I personally diagnosed epidermolysis bullosa simplex, Tracy. The team did.
The same team you're praising for their efficiency a moment ago?
Exactly.
Well then, it seems to me, Hawks, that we've got two problems on our hands. One is the inaccurate diagnosis, and another one is your inability to admit when you're wrong.
Oh, I see. So it's okay for me to be wrong, but not for everyone else. Nice.
You know what, Hawks? It's time you grow up and take responsibility for your actions instead of trying to blame others all the time.